Phlebotomy Certification Questions and Answers 2026. Question 1. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A 24-hour pooled collection. Option B, a random, first morning voided specimen. Option C, a multisample postprandial catch. Option D, a catheterized 12-hour collection sequence. The correct answer is option B, a random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 2. Which of the following blood components is responsible for the initiation of the coagulation process? Option A, erythrocytes. Option B, leukocytes. Option C, thrombocytes. Option D, hemoglobin. The correct answer is option C, thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 3. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A, cryoglobulins. Option B, ammonia. Option C, lactic acid. Option D, free fatty acids. The correct answer is option A, cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 4. What is the function of the thixotropic gel inside an SST or PSD tube? Option A, to accelerate the coagulation cascade. Option B, to form a physical barrier between cells and serum/plasma during centrifugation. Option C, to preserve glucose levels for up to 24 hours. Option D, to chelate calcium and prevent fibrin formation. The correct answer is option B, to form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 5. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 6. Which of the following tests requires that the sample be protected from light by wrapping the tube in aluminum foil? Option A, vitamin B12 and carotene. Option B, blood urea nitrogen, BUN. Option C, partial thromboplastin time, PTT. Option D, complete blood count, CBC. The correct answer is option A, vitamin B12 and carotene. Vitamin B12 and carotene are light sensitive and may require protection with foil or an amber container. Light exposure can degrade sensitive analytes and produce inaccurate results. BUN, PTT, and CBC do not have the same routine light protection requirement. Question 7. What is the clinical name for the thin, white layer of cells that forms between the plasma and red blood cells when an anticoagulated blood sample is centrifuged? Option A, serum layer. Option B, buffy coat. Option C, fibrin web. Option D, thrombotome. The correct answer is option B, buffy coat. The buffy coat is the thin whitish layer between plasma and red cells after centrifuging anticoagulated blood. It contains leukocytes and platelets. Serum, fibrin, and clot material are associated with different specimen states. Question 8. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A. It causes severe tissue tearing upon skin entry. Option B. It carries an extremely high risk of causing hemolysis in the sample. Option C. It penetrates too deeply into the bacillic structures. Option D. Vacuum tubes will lose their suction pressure entirely. The correct answer is option B. It carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 9. What type of communication technique involves nodding, maintaining eye contact, and repeating back statements to ensure clear understanding? Option A. Passive communication. Option B. Aggressive communication. Option C. Active listening. Option D. Defensive communication. The correct answer is option C. Active listening. Active listening uses eye contact, nodding, attentive posture, and restating information to confirm understanding. It helps patients feel heard and reduces miscommunication during care. Passive, aggressive, or defensive communication does not reliably verify understanding. Question 10. Which of the following values represents a panic or critical laboratory value that must be reported immediately? Option A fasting glucose of 90 mg/dl. Option B. A potassium level of 2.1 mg/L. Option C. A total cholesterol level of 210 mg/dl. Option D. A white blood cell count of 7,500/mcl. The correct answer is option B. A potassium level of 2.1 mg/L. A potassium level of 2.1 mg/L is critically low and can cause dangerous cardiac rhythm disturbances. Critical values must be reported immediately according to facility policy. Normal glucose or white blood cell values do not require urgent panic notification. Question 11. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option A 1.0 mm. Option B 2.0 mm. Option C 3.0 mm. Option D 4.0 mm. The correct answer is option B 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 12. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 13. What is the modern medical term for a condition characterized by an abnormally low white blood cell count? Option A leukocytosis. Option B leukopenיה. Option C thrombocytopenia. Option D polycythemia. The correct answer is option B, leukopenיה. Leukopenia means an abnormally low white blood cell count. It may indicate marrow suppression, infection effects, medication effects, or immune compromise depending on context. Leukocytosis is high white blood cells, while thrombocytopenia and polycythemia refer to platelets and red cell mass. Question 14. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A, the posterior curvature of the heel directly over the calcaneus bone. Option B, the medial or lateral margins of the plantar surface of the heel. Option C, the central arch area of the foot pad. Option D, the tips of the smaller toes. The correct answer is option B, the medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 15. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option F 1.0 mm, option B 2.0 mm, option C 3.0 mm, option D 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 16. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option of light blue top. Option B, lavender top, EDTA. Option C, gray top. Option D, green top. The correct answer is option B, lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 17. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A, droplet transmission. Option B, contact transmission. Option C, airborne transmission. Option D, vector-borne transmission. The correct answer is option C, airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 18. What color top tube is used to collect specimens for blood bank immunohematology testing like antibody screens? Option A, pink top or glass red top. Option B, gray top. Option C, light blue top. Option D, light green top. The correct answer is option A, pink top or glass red top. Pink EDTA tubes or glass red tubes are commonly used for blood bank immunohematology testing such as antibody screens. These specimens support red cell typing and compatibility testing. Gray, light blue, and light green tubes serve glucose, coagulation, and chemistry testing needs. Question 19. What type of mask is required when entering a room designated for droplet precautions? Option A, a certified N95 respirator mask. Option B, a standard fluid-resistant surgical mask. Option C, a cloth face covering or scarf. Option D, no mask is required if you stay 2 feet away from the bed. The correct answer is option B, a standard fluid-resistant surgical mask. Droplet precautions require a standard fluid-resistant surgical mask when entering the patient's room or working close to the patient. The mask blocks larger respiratory droplets from reaching mucous membranes. N95 respirators are used for airborne precautions, not routine droplet isolation. Question 20. What is the clinical term for blood that has escaped from a vessel into the surrounding tissue layers? Option A, petechiae. Option B, hematoma. Option C, thrombus. Option D, hemostasis. The correct answer is option B, hematoma. A hematoma is blood that has leaked from a vessel into surrounding tissue. It may appear as swelling, bruising, or tenderness at the puncture site. Petechiae are pinpoint hemorrhages, while a thrombus is a clot inside a vessel. Question 21. What type of specimen is used for a guaiac smear test? Option A, sputum. Option B, urine. Option C, feces. Option D, cerebrospinal fluid. The correct answer is option C, feces. A guaiac smear tests feces for occult blood. It is used to screen for hidden gastrointestinal bleeding that may not be visible. Sputum, urine, and cerebrospinal fluid are collected for different diagnostic purposes. Question 22. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A. Wearing a face shield when opening specimen tubes. Option B. Utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C. Washing hands with antimicrobial soap for 20 seconds. Option D. Following a strict order of draw sequence. The correct answer is option B. Utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 23. Which of the following is an example of a vector-borne transmission? Option A. Contracting a cold from an airborne sneeze. Option B. Acquiring a skin infection from a contaminated countertop. Option C. Getting bit by a mosquito infected with West Nile virus. Option D. Drinking water containing bacterial toxins. The correct answer is option C. Getting bit by a mosquito infected with West Nile virus. Vector-borne transmission involves a living carrier that moves an infectious agent from one host to another. Mosquito transmission of West Nile virus is a classic example. Airborne droplets, contaminated surfaces, and contaminated water represent other transmission routes. Question 24. What is the definition of fomite in an infection control context? Option A. An insect that transmits a virus. Option B. An inanimate object capable of harboring and transmitting infectious agents. Option C. A chemical agent used to sanitize skin surfaces. Option D. A specific type of airborne droplet nucleus. The correct answer is option B. An inanimate object capable of harboring and transmitting infectious agents. A fomite is a non-living object that can carry infectious material from one person or surface to another. Examples include bedrails, equipment, pens, and contaminated trays. Vectors are living carriers, while antiseptics and airborne particles describe different infection control concepts. Question 25. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 26. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B. Drop the needle into a biohazard waste bag with blood-stained gauze. Option C. Set the needle down on the patient's bedside table until the tubes are fully labeled. Option D. Detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 27. What is the correct order of draw for a multitube venipuncture sequence involving a coagulation tube, a blood culture, and a hematology tube? Option A. Light blue, blood culture, lavender. Option B. Blood culture, light blue, lavender. Option C, lavender, light blue, blood culture. Option D, blood culture, lavender, light blue. The correct answer is option B, blood culture, light blue, lavender. Blood cultures are collected first to maintain sterility, followed by light blue coagulation tubes and then lavender hematology tubes. This order reduces contamination and additive carryover. Drawing EDTA before citrate can interfere with coagulation results. Question 28. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A, wash the site with soap and water and immediately report the incident to a supervisor. Option B, squeeze the wound to expel blood and apply a tight bandage. Option C, wait until the end of the shift to fill out an incident report. Option D, ask the patient if they have any blood-borne infectious diseases. The correct answer is option A, wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 29. What is the function of the thixotropic gel inside a plasma separator tube, PSD? Option A, to accelerate the activation of the coagulation cascade. Option B, to form a physical separation barrier between the cells and the plasma layer during centrifugation. Option C, to preserve the concentration of glucose molecules for 24 hours. Option D, to bind heavy metals and trace elements within the sample. The correct answer is option B, to form a physical separation barrier between the cells and the plasma layer during centrifugation. The gel in a plasma separator tube forms a physical barrier between plasma and cells during centrifugation. This reduces ongoing cellular metabolism and analyte exchange after separation. The anticoagulant in the tube is lithium heparin, not the gel itself. Question 30. Which of the following structures is an example of an unoxygenated blood carrier? Option A, pulmonary vein. Option B, aorta. Option C, superior vena cava. Option D, brachial artery. The correct answer is option C, superior vena cava. The superior vena cava carries deoxygenated blood from the upper body back to the right atrium. Most systemic veins carry unoxygenated blood, while most systemic arteries carry oxygenated blood away from the heart. The pulmonary vein is an exception because it carries oxygenated blood to the left atrium. Question 31. What should a phlebotomist use to cleanse the skin surface prior to collecting a blood alcohol specimen for legal purposes? Option A, 70% isopropyl alcohol prep pads. Option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Option C, tincture of iodine solution. Option D, concentrated hydrogen peroxide spray. The correct answer is option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Blood alcohol specimens for legal testing should be collected using a non-alcohol skin cleanser such as povidone iodine, chlorhexidine, or soap and water. This avoids any appearance that alcohol from the prep contaminated the specimen. Routine isopropyl alcohol pads are avoided for forensic alcohol collections. Question 32. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A, complete blood count, CBC. Option B, blood cultures. Option C, erythrocyte sedimentation rate, ESR. Option D, C-reactive protein, CRP. The correct answer is option B, blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 33. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A, Ben95 respirator and gloves. Option B, gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 34. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A, hemoconcentration of the plasma. Option B, hemolysis of the red blood cells. Option C, complete inhibition of clotting factors. Option D, falsely elevated platelet counts. The correct answer is option B, hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 35. What should a phlebotomist do if they observe a hematoma forming rapidly under the skin surface while performing a venipuncture? Option A, adjust the needle angle to try to drain the hematoma into the collection tube. Option B, terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. Option C, instruct the patient to pump their fist forcefully to redistribute the blood. Option D, advance the needle deeper to pass completely through the hematoma layers. The correct answer is option B, terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. A rapidly forming hematoma means blood is escaping from the vessel into surrounding tissue. The draw should be stopped, the tourniquet released, the needle removed, and firm pressure applied. Continuing the attempt can enlarge the hematoma and increase pain or bruising. Question 36. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A, light blue top, sodium citrate. Option B, green top, heparin. Option C, lavender top, EDTA. Option D, grey top, potassium oxalate. The correct answer is option B, green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 37. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A, prothrombin time, patient. Option B, erythrocyte sedimentation rate, ESR. Option C, basic metabolic panel, BMP. Option D, blood culture series. The correct answer is option B, erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 38. What does the term basal state refer to in clinical laboratory testing? Option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B, the physical state of the body directly following a heavy workout session. Option C, the point of highest metabolic activity in the afternoon. Option D, the body state while under heavy psychological stress. The correct answer is option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 39. If a phlebotomist needs to collect blood from an infant via venipuncture, what is the preferred needle choice? Option A 21 gauge standard multisample needle. Option B, an 18 gauge hypodermic needle. Option C, a 23 gauge or 25 gauge winged infusion set, butterfly. Option D, a large bore trocar needle. The correct answer is option C, a 23-gauge or 25-gauge wind infusion set, butterfly. Infant venipuncture requires a small, controlled device to reduce vessel trauma. A 23 or 25-gauge wind infusion set allows better stability and visualization in small veins. Large bore needles increase injury risk and are not appropriate for fragile pediatric veins. Question 40. What type of safety equipment should be accessed if a hazardous chemical splashes directly onto a phlebotomist's arms and torso? Option A standard eye wash station. Option B, a safety drench shower. Option C, a fire blanket wrap. Option D, an isolation gown station. The correct answer is option B, a safety drench shower. A safety drench shower is used when hazardous chemicals splash over large body areas such as the arms and torso. Immediate flushing helps dilute and remove the chemical to reduce tissue damage. An eye wash station is designed for eye exposure rather than full body contamination. Question 41. What is the correct site for performing a dermal puncture on an adult patient's finger? Option A, the exact center of the finger pad on the index finger. Option B, the fleshy, off-center side of the distal segment of the middle or ring finger. Option C, the side of the pinky finger close to the nail bed. Option D, the palmar crease of the thumb. The correct answer is option B, the fleshy, off-center side of the distal segment of the middle or ring finger. Adult finger puncture is performed on the fleshy, off-center side of the distal segment of the middle or ring finger. This location provides good capillary flow while avoiding bone and heavy nerve concentration. The center pad, thumb, index finger, pinky, and nail areas are less desirable. Question 42. Which of the following parameters must be strictly managed when collecting a sweat chloride test? Option A, keeping the sample frozen using dry ice. Option B, preventing evaporation of the sweat sample during collection. Option C, protecting the collecting flask from ambient artificial lights. Option D, drawing a matching light blue tube within 5 minutes. The correct answer is option B, preventing evaporation of the sweat sample during collection. Sweat chloride specimens must be protected from evaporation because chloride concentration can change as water is lost. Proper sealing and timely handling preserve the true concentration. Freezing, light protection, or paired coagulation tubes are not the main handling concern. Question 43. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A, the needle will slip and miss the vein entirely. Option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C, the patient's blood pressure will drop rapidly. Option D, the vacuum inside the collection tube will increase significantly. The correct answer is option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 44. Which of the following tests requires a plain red top tube with no gel or additives? Option A, complete blood count, CBC. Option B, type and screen. Option C, certain therapeutic drug levels that bind to gel barriers. Option D, plasma glucose tracking. The correct answer is option C, certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 45. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A, change the requisition manually using a pen to match the verbal statement. Option B, contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C, draw the blood and sort out the labeling discrepancy later in the lab. Option D, assume the patient knows their own name and print a new label on the spot. The correct answer is option B, contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 46. What should a phlebotomist do if an outpatient becomes pale, sweaty, and complains of feeling dizzy before you insert the needle? Option A. Proceed quickly with the puncture before they pass out completely. Option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Option C. Instruct the patient to take deep, rapid breaths to hyperventilate. Option D. Give the patient a glass of hot water to drink immediately. The correct answer is option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Pallor, sweating, and dizziness before needle insertion suggest an impending fainting episode. Preparation should stop, the patient should be reclined or assisted safely, and symptoms should be managed before any draw attempt. Continuing may lead to syncope, falls, or injury. Question 47. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A. Interpreting abnormal lab results for patients. Option B. Ensuring specimen tubes are collected, labeled, and transported correctly. Option C. Changing medication doses based on therapeutic levels. Option D. Performing complex tissue biopsies in the operating room. The correct answer is option B. Ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 48. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A. Prone position. Option B. High Fowler's position. Option C. Supine with legs elevated or flat. Option D. Standing upright with assistance. The correct answer is option C. Supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 49. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens? Option A. CDC. Option B. FDA. Option C. OSHA. Option D. CLSI. The correct answer is option C. OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 50. What is the proper location for a capillary puncture on an infant's foot? Option A. The center of the plantar surface near the arch. Option B. The medial or lateral borders of the plantar surface of the heel. Option C. The tip of the great toe. Option D. The posterior curvature of the heel bone. The correct answer is option B. The medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 51. What should a phlebotomist use to clean a workspace surface that has been contaminated by a blood spill? Option A. 70% isopropyl alcohol. Option B. A 1:10 dilution of sodium hypochlorite, bleach. Option C. Plain warm soap and water. Option D. Concentrated chlorhexidine solution. The correct answer is option B. A 1:10 dilution of sodium hypochlorite, bleach. Blood spills should be disinfected with an appropriate bleach dilution or approved hospital disinfectant. A 110 sodium hypochlorite solution is commonly used because it inactivates many blood-borne pathogens. Soap and water alone remove soil but do not provide adequate disinfection for a blood spill. Question 52. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A, orange top. Option B, light blue top. Option C, lavender top. Option D, gray top. The correct answer is option A, orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 53. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A, lipemia. Option B, icterus. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option C, hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lipemia appears milky, and icterus appears yellow to amber. Question 54. Which of the following is an example of an analytical component of quality assurance? Option A, double-checking patient identity wristbands. Option B, ensuring proper maintenance and calibration of automated laboratory equipment. Option C, delivering critical panic results to a physician on time. Option D, labeling the collection tubes at the bedside. The correct answer is option B, ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 55. What should a phlebotomist do if an inpatient's door is closed and a sign states "No visitors, see nurse" before entering? Option A, knock loudly, open the door, and walk right in to maintain efficiency. Option B, locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C, skip the patient and come back at the end of the shift without checking in. Option D, call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B, locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 56. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A, vehicle-borne transmission. Option B, vector-borne transmission. Option C, airborne transmission. Option D, direct contact transmission. The correct answer is option A, vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks. Question 57. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option A, voiding directly into the cup without any prior cleaning steps. Option B, cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C, saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D, restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B, cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 58. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing? POCT instruments. Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 59. Why is a royal blue top tube used for trace element and toxicology testing? Option A. The tube contains a unique fast-acting liquid anticoagulant. Option B. The tube stoppers are specially manufactured to be free of trace element contamination. Option C. The tube is thicker to resist breaking in specialized centrifuges. Option D. The tube completely blocks out all infrared and UV rays. The correct answer is option B. The tube stoppers are specially manufactured to be free of trace element contamination. Royal blue tubes are manufactured to minimize trace element contamination from stoppers, glass, plastic, and additives. This is essential for toxicology and trace metal testing where very small contamination can alter results. The color does not mainly indicate light protection or faster anticoagulation. Question 60. What type of isolation protocol requires healthcare workers to wear a gown, gloves, and use dedicated equipment to prevent spreading resistant GI infections like C. difficile? Option A, airborne isolation. Option B, droplet isolation. Option C, contact isolation. Option D, protective reverse isolation. The correct answer is option C, contact isolation. Contact isolation is used for organisms spread by touch or contaminated equipment, including resistant gastrointestinal pathogens such as C. difficile. Gown, gloves, and dedicated equipment reduce environmental spread. Airborne and droplet precautions target respiratory transmission routes. Question 61. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A. It decreases the pain perception of the infant. Option B. It increases localized arterial blood flow up to 7-fold. Option C. It sterilizes the deeper layers of the epidermis. Option D. It prevents the formation of an unneeded hematoma. The correct answer is option B. It increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 62. What is the clinical term for a localized infection or inflammation of the bone caused by accidental needle striking during a heel stick? Option A, osteosarcoma. Option B, osteomyelitis. Option C, osteoarthritis. Option D, osteopenia. The correct answer is option B, osteomyelitis. Osteomyelitis is infection or inflammation of bone. In heel puncture, it can occur if the lancet penetrates too deeply and injures the calcaneus. Proper site choice and maximum depth limits are used to prevent this serious complication. Question 63. What type of collection is performed to screen for hidden blood in a stool specimen? Option A, occult blood test, GWAEC. Option B, culture and sensitivity, C&S. Option C, Dover and parasites, O&P. Option D, fecal fat quantification. The correct answer is option A, occult blood test, GWAEC. An occult blood test, often using a GWAEC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, over and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 64. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A. Check the site to confirm that active bleeding has completely stopped. Option B. Ask the patient to bend their elbow firmly over the gauze pad. Option C. Apply a generous layer of antibiotic ointment to the wound. Option D. Label the tubes using the patient's bedside charts. The correct answer is option A. Check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 65. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A. 70 to 99 mg/dl. Option B. 140 to 180 mg/dl. Option C. 200 to 250 mg/dl. Option D. 300 to 350 mg/dl. The correct answer is option A. 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 66. What occurs during the pre-analytical phase of laboratory operations? Option A. Running standard controls on a chemistry profile machine. Option B. All processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. Option C. Interpreting a bone marrow biopsy under a microscope. Option D. Transmitting final electronic medical record entries to billing. The correct answer is option B. All processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. The pre-analytical phase includes everything that happens before actual testing, including orders, patient identification, collection, handling, and transport. Many laboratory errors occur in this phase because specimen quality is established before analysis begins. Analyzer operation and result reporting belong to later phases. Question 67. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option A. Light blue top. Option B. Lavender top. Option C. Gray top. Option D. Green top. The correct answer is option C. Gray top. Gray tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing gray tubes too early increases additive carryover risk. Question 68. What should a phlebotomist do if a patient begins to have a grand mal seizure during a venipuncture? Option A. Hold the needle steady inside the vein to complete the draw. Option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. Option C. Place a wooden tongue depressor inside the patient's mouth to protect their tongue. Option D. Restrain the patient's arms firmly against the drawer chair to stop all movement. The correct answer is option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. A seizure during venipuncture requires immediate removal of the needle and tourniquet to prevent injury. The patient should be protected from surrounding hazards and medical help should be called. Restraining the patient or placing objects in the mouth can cause harm. Question 69. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A. Draw the blood anyway and ask the patient to state their name. Option B. Look for the ID band on the nightstand or 4-pole and scan it. Option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D. Verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bedrail, or four-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 70. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act, HIPAA? Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 71. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A. Vein. Option B. Artery. Option C. Capillary. Option D. Venule. The correct answer is option B. Artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 72. What does the term lipemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C. A dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D. A clear, watery fluid component lacking any cellular proteins. The correct answer is option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 73. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A. To prevent the alcohol from evaporating too fast. Option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 74. What is the minimum amount of time a serum separator tube, SSD, must stand in a vertical rack to clot completely before centrifugation? Option A. 5 minutes. Option B. 10 minutes. Option C. 30 minutes. Option D. 90 minutes. The correct answer is option C. 30 minutes. Serum separator tubes usually need about 30 minutes upright to clot fully before centrifugation. Spinning before clot completion can produce fibrin strands and interfere with serum separation. Waiting too little risks poor specimen quality, while excessive delay may affect some analytes. Question 75. What does the term erythema mean? Option A. Redness of the skin caused by congestion or inflammation of the capillaries. Option B. A pale appearance of the skin due to low red cell counts. Option C. A bluish tint to the skin caused by a lack of oxygen. Option D. A yellowing of the skin caused by high bilirubin levels. The correct answer is option A. Redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 76. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 77. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A. Draw the blood quietly without waking them up to minimize pain. Option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C. Skip the patient and mark them as unavailable on the computer. Option D. Ask the patient's roommate to confirm their identity for you. The correct answer is option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 78. Which analytical error is categorized as a pre-examination, pre-analytical error? Option A. Miscalibrating a chemistry analyzer machine. Option B. Misidentifying a patient before collecting their sample. Option C. Misinterpreting a reading on a microscopic smear sheet. Option D. Delays in transmitting finalized electronic reports to the doctor. The correct answer is option B. Misidentifying a patient before collecting their sample. Misidentifying a patient before collection is a pre-examination error because it occurs before the specimen is analyzed. Pre-analytical errors often have the greatest impact on patient safety because the wrong sample can produce a believable but unsafe result. Analyzer calibration and report transmission belong to later phases. Question 79. Which of the following conditions can cause a specimen to be rejected due to icterus? Option A. Falsely high fats in the patient's diet. Option B. High concentrations of bilirubin in the serum or plasma sample. Option C. Excessive destruction of red cells inside the tube due to rough handling. Option D. Utilizing the wrong color top tube during collection. The correct answer is option B. High concentrations of bilirubin in the serum or plasma sample. Icterus describes a yellow to amber serum or plasma appearance caused by high bilirubin concentration. It can interfere with certain laboratory methods and may lead to rejection or result comments depending on severity. Lipemia and hemolysis create cloudy or red appearances rather than bilirubin-related discoloration. Question 80. What color top tube contains the additive sodium citrate and is used for coagulation profiles? Option A. Light blue top. Option B. Lavender top. Option C. Green top. Option D. Gray top. The correct answer is option A. Light blue top. Light blue tubes contain sodium citrate and are used for coagulation profiles. Citrate binds calcium reversibly and preserves clotting factors for testing when the tube is properly filled. Other tube colors contain additives that can interfere with coagulation assays. Question 81. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A. Basic metabolic panel, BMP. Option B. Forensic drug analysis or paternity testing. Option C. Therapeutic drug monitoring for digoxin. Option D. Blood culture tracking for endocarditis. The correct answer is option B. Forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 82. What tube additive prevents clotting by binding or chelating calcium? Option A. Lithium heparin. Option B. DDTA. Option C. Sodium polyethylene sulfonate. Option D, thrombin. The correct answer is option B, EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 83. If a phlebotomist must collect blood from a patient with an active, running foreline in both arms, what is the preferred option? Option A, draw the blood from a capillary puncture if the tests allow. Option B, turn off the for yourself and draw above the line immediately. Option C, draw from the foot or ankle without a physician's order. Option D, postpone the draw indefinitely until the patient is discharged. The correct answer is option A, draw the blood from a capillary puncture if the tests allow. When both arms have running forelines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 84. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A, pull, aim, squeeze, sweep. Option B, push, aim, slice, secure. Option C, pull, activate, squeeze, shake. Option D, press, aim, secure, sweep. The correct answer is option A, pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 85. Which of the following elements is a key component of quality control in a point-of-care testing (POCT) program? Option A, documenting the daily temperature of the laboratory refrigerator. Option B, verifying that the patient's insurance information is updated. Option C, running electronic or liquid controls according to manufacturer and facility guidelines. Option D, cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C, running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 86. What type of vessel links the arterial system directly to the capillary network paths? Option A, arteriole. Option B, venule. Option C, vena cava. Option D, deep vein. The correct answer is option A, arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 87. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 88. Which of the following options describes the best method to prevent a vein from rolling during needle insertion? Option A, tying the tourniquet directly over the intended puncture site. Option B, anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Option C, having the patient pump their fist continuously during needle insertion. Option D, inserting the needle quickly at a sharp 90-degree angle. The correct answer is option B, Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Anchoring pulls the skin taut below the puncture site to stabilize the vein. This prevents rolling and allows a controlled needle entry. Tying the tourniquet over the site, fist pumping, or using a steep angle can increase injury or specimen problems. Question 89. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A, human immunodeficiency virus, HIV. Option B, hepatitis B virus, HBV. Option C, tuberculosis, TB. Option D, malaria. The correct answer is option B, hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 90. Which of the following tubes contains a clot activator paired with a gel barrier separator? Option A, gold top, SST. Option B, light green top, PSD. Option C, lavender top. Option D, light blue top. The correct answer is option A, gold top, SST. Gold SST tubes contain a clot activator and gel separator. The clot activator promotes serum formation, and the gel forms a barrier during centrifugation. PSD tubes contain heparin for plasma, while lavender and light blue tubes contain anticoagulants for other testing. Question 91. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A, clear or plain red glass top. Option B, light blue top. Option C, lavender top. Option D, light green top. The correct answer is option A, clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 92. Which of the following tests measures the average blood glucose concentration over the past 2 to 3 months? Option A, fasting blood sugar, FBS. Option B, oral glucose tolerance test, OGTT. Option C, hemoglobin A1C, HbA1c. Option D, postprandial glucose test. The correct answer is option C, hemoglobin A1C, HbA1c. Hemoglobin A1c reflects the percentage of hemoglobin that has glucose attached over the lifespan of red blood cells. It estimates average blood glucose over roughly 2 to 3 months. Fasting and postprandial glucose tests measure glucose at a specific point in time. Question 93. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A, the needle will cause the hematoma to spread to the opposite arm. Option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C, the vacuum tubes will implode due to tissue density variations. Option D, it will cause immediate and permanent paralysis of the limb. The correct answer is option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 94. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 95. Which of the following situations can lead to a lawsuit charging a phlebotomist with battery? Option A. Drawing blood from a patient who has explicitly refused the procedure. Option B. Making a minor clerical error on a specimen tube label. Option C. Forgetting to wash hands between routine patient encounters. Option D. Accidentally causing a small hematoma during an authorized draw. The correct answer is option A. Drawing blood from a patient who has explicitly refused the procedure. Battery involves unauthorized or offensive physical contact with another person. Drawing blood after a patient has explicitly refused the procedure can meet that definition. Documentation errors, hand hygiene lapses, or authorized complications involve different legal issues. Question 96. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A. Flammability hazard. Option B. Reactivity hazard. Option C. Health hazard. Option D. Special or specific hazard. The correct answer is option C. Health hazard. The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 97. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A. Serum. Option B. Plasma. Option C. Whole blood. Option D. Fibrin clot. The correct answer is option B. Plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 98. What color tube top indicates that the tube contains the additive sodium heparin? Option A. Light blue. Option B. Dark green. Option C. Lavender. Option D. Light green. The correct answer is option B. Dark green. Dark green tubes indicate sodium heparin in many tube systems. Sodium heparin prevents clotting by interfering with thrombin activity and is used for selected chemistry or special testing. Light green usually contains lithium heparin with gel, while lavender and light blue contain different anticoagulants. Question 99. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A. Enlist colleagues to restrain the patient by force without nursing guidance. Option B. Postpone the draw and consult with the nurse in charge of the patient's care. Option C. Attempt to draw blood while the patient is asleep. Option D. Cancel the test order permanently on your own authority. The correct answer is option B. Postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 100. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A. The veins are too large and prone to exploding. Option B. The lack of muscle movement leads to poor circulation and potential thrombosis. Option C. The patient cannot feel if a nerve is being struck by the needle. Option D. Paralyzed limbs do not contain white blood cells. The correct answer is option B. The lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern.